Differential diagnosis of a retroperitoneal mass, 12 to 15 centimeters. A retroperitoneal mass of this size in a pediatric or adult patient has a broad differential diagnosis. It can be classified based on its origin. Shutter 1. Neoplastic causes. Benign tumors, lipoma, leiomyoma, fibroma, schwannoma. Malignant tumors, liposarcoma, leiomyosarcoma, rhabdomyosarcoma, fibrosarcoma, neuroblastoma, common in children, Wilms tumor, common in children, renal cell carcinoma if arising from the kidney, lymphoma, germ cell tumors. And 2. Non-neoplastic causes, infectious causes, tubercular abscess, pyogenic abscess, inflammatory conditions, retroperitoneal fibrosis, pancreatic pseudocyst, vascular causes, aneurysms, e.g. abdominal aortic aneurysm, congenital anomalies, cystic lymphangioma, duplication cyst, Tashka approach to the patient with a retroperitoneal mass. 1. Detailed history and physical examination. History. Age, neuroblastoma, and Wilms tumor are more common in children, whereas sarcomas are more prevalent in adults. Symptoms: weight loss, night sweats, fever, suggest lymphoma, abdominal pain, or palpable mass. History of trauma, infections, or malignancy. Physical examination: assess for abdominal tenderness, palpable mass, lymphadenopathy, hepatosplenomegaly, and signs of systemic disease. 2. Initial laboratory investigations. Complete blood count CBC, assess for anemia or leukocytosis. Renal function tests, evaluate obstruction or renal involvement. Liver function tests, if metastases or systemic involvement is suspected. Tumor markers, if indicated, alpha-fetoprotein AFP, germ cell tumors, beta-HCG, germ cell tumors, urinary catecholamines, VMA, HVA, neuroblastoma. 3. Imaging studies. Ultrasound USG, initial imaging to evaluate cystic versus solid nature. CT scan, contrast enhanced, provides detailed anatomical delineation, relationship to nearby structures, and vascular involvement. Can differentiate lipomas, liposarcomas, and renal cell carcinomas. MRI, useful for soft tissue characterization and distinguishing vascular or neural tumors. PET-CT, if malignancy suspected, for staging and identifying the metastasis. 4. Biopsy, if needed. Core needle biopsy or image-guided biopsy, essential for histological diagnosis when imaging is inconclusive. Avoid biopsy if imaging strongly suggests a vascular or infectious lesion to prevent complications. 1. Preoperative planning. Multidisciplinary team discussion involving oncologists, surgeons, radiologists, and pathologists. Address comorbid conditions and ensure patient optimization, e.g., correction of coagulopathy or renal dysfunction. 2. Surgical management. Indications for surgery. Large symptomatic or growing mass, malignant or potentially malignant lesions. Extent of resection. Aim for complete surgical resection with negative margins, R0 resection in malignancies. Preserve critical structures when feasible. 3. Adjuvant therapy, if needed. Chemotherapy, indicated for lymphoma, germ cell tumors, and pediatric cancers like neuroblastoma or Wilms tumor. Radiotherapy, often used for sarcomas or as palliative treatment in unresectable cases. 4. Management of non-neoplastic conditions. Infectious masses, treat with antibiotics or drainage if abscess is present. Vascular lesions, endovascular repair, e.g. aneurysms. Inflammatory lesions, steroids or immunosuppressive therapy for retroperitoneal fibrosis. Follow-up and monitoring. Regular imaging, CT or MRI to monitor for recurrence or progression. Tumor marker levels, if applicable, to track therapeutic response. Multidisciplinary care for long-term management, especially in malignancies. This approach ensures a systematic evaluation, diagnosis, and tailored treatment plan for a large retroperitoneal mass.